Welcome back to The Wellness Effect. As always, remember to subscribe and hit that notification bell so you don't miss out on this and our other discussions. Dr. Wilhelm Van Zijl is an oncologist with an interest in urogenital, in particular prostate cancer. He's going to shed some light on this condition for us today and help us understand some of the treatment options. Welcome, Zijl.
Thank you very much. Good to be here.
Good to have you here. Prostate cancer is a huge issue for men. So if my dad or my brother had prostate cancer, am I at risk of having prostate cancer?
It's a very relevant question. You are male, you have a prostate, so alas, yes, you are at risk. In the UK, they did an interesting series on men that died at a very advanced age circa 90 or something. And it's actually like a train on a track. You've got a prostate, it's eventually going to be developed into a prostate with cancer. Doesn't mean you're going to die from it. You're just going to eventually get prostate cancer. But no, if you, at your age, have a family history with a dad or perhaps a grandfather or perhaps an uncle, it doesn't mean that you're at risk now. You are slightly above the average risk. In fact, it's probably around about 5% higher risk than Joe Soap. So what do you need to do? Well, look at your ID book. When you turn 45, you start testing. Not before, there's no use. Don't run to the lab now and go and do a blood test. It's going to be a waste of time and money. But when you turn 45, some of the guidelines will tell you around about age 50. You do need to start testing if you have a positive family history.
And if you're diagnosed with prostate cancer, does it affect your life?
It does. More so the younger you are. Obviously, there's the impact in terms of sexual health, but the moment that the word cancer looks at you, I mean, there is huge mental and social issues. And then treatment obviously has significant effect in terms of your life and quality of life. It's interesting, in one of your other discussions, there's been talk about the geriatrics and as men age, keeping muscle strength, etc. One of the bad things we do as a cornerstone of prostate cancer is we bring about a reduction in the normal male hormones, which is good for muscle strength and good for sexuality and good for cognition and drive and motivation. But you then take this away, and then there is definitely an impact on quality of life. But it has a tremendous impact on the cancer. So a price to pay, yes, but with a significant advantage in terms of survival.
So, doctor, what are the most common treatments for prostate cancer?
Very relevant question, but we need to quickly separate them. We're going to today speak on local prostate cancer, meaning the disease is still in the prostate and has not left the prostate. When a disease leaves an organ system, we call that metastatic disease, and that's a completely different topic. Very exciting, but not for today. So the common treatments would be, well, surgery if possible. If you can operate a breast or you can operate a lung, you can definitely also operate a prostate, and a urologist, not an oncologist, a urologist will surgically, with various different techniques, remove the prostate. Well, then you don't have a prostate anymore. In the world of oncology, we can leave the prostate there, but then kill it by means of radiation.
So let's talk about surveillance, doctor. I've heard this growing trend of individuals who are diagnosed with prostate cancer, but don't immediately go for surgery. They're almost on this treatment plan that is a different requirement.
Very, very important words that you use there. Plan and treatment. So active surveillance, and the word active is equally important, implies a technique of postponing treatment, not avoiding it, postponing treatment until it is as late as possible, but still possible to cure. We don't use active surveillance when it's a metastatic disease, as we spoke about earlier. This is a man that's been diagnosed with cancer, but because of various favorable characteristics, it's not this wild animal that is about to run rampant through your body. We can postpone treatment by observing how it acts. It implies checking of the blood tests with PSA, repeating the MRI of the pelvis to see whether the disease does not grow. And in certain protocols, there would even be repeat biopsies where a urologist would take pieces again and assess what happens with this. So delaying or avoiding and postponing, the correct word, therapy with the intent to cure later.
There are different forms of treatment, But of the treatments, will they put you out of work for a substantial time frame? Because I think a lot of the time men think that if I get treated, then I won't be able to work, I won't be able to provide for my family, etc.
It's good questions, and it of course depends on what your circumstances are. An interesting one, a gentleman that has to fly a lot for work in various countries tells me that I can't go for a prostatectomy. He says everybody will know when I sit in a board meeting, it would be on my forehead, I had prostatectomy. Now, obviously, it's not really the case, but his concern was that he would not be able to immediately travel. The old dictum of so-called 6 weeks of sick leave is theoretically applicable after invasive surgery, and you won't be able to go back to work tomorrow. You'll eventually have a catheter and you may leak, etc., but you'll be back to work depending on what your activities are. If you're sitting in a boardroom and you just have to go over the figures versus if you're a manual laborer, exertion and what pressures happen in your abdomen might cause a little bit of a leak or not. So surgery has got certain implications. But taking out the workplace or not is completely different when we're talking radiation.
Mm.
A patient can take their lunch break, dash in for radiation on a daily basis for half an hour for 6 consecutive weeks, and still be working. But if your town where you live and the town where you have radiation is hours apart, well, how do you then do that?
Mm.
So that sometimes means that a patient will be out of the workplace for 6 full weeks because he needs to be in Pretoria or Johannesburg or Durban or Cape Town where there is a machine that can do it. There's a nice completely different scenario, and that is when we implant the radiation seeds inside the prostate. And then it's proverbially 1 day of sick leave, where the patient goes to theater, the urologist and the oncologist works together in that procedure, implant the seeds into the prostate. And dear Johnny literally has been there boasting that the next day he went to play golf. I have heard that and seen that with my own eyes. And that is how little the impact of brachytherapy can be. So there's various possible scenarios of how it can impact in your world.
And what sort of side effects do these various treatment options give patients?
So brachytherapy, the implant, brachos means very short in Greek. The seeds are implanted in you. Well, a little bit of discomfort for the first few days, and then subsequently, in typically the second, third, or the fourth month, you'll have difficulty with your urination, irritation, frequency, getting up at night more regularly, and perhaps a degree of fatigue, and then it wears off. And that's that. No hair loss, no nausea, no vomiting. It's not chemotherapy, it's radiation on a local spot. Contrary to that, if we have radiation on a daily basis, Monday, Tuesday, Wednesday, Thursday, Friday, for 6 consecutive weeks, it's like running the comrades. Nobody complains about the first 10 Ks. They're all well and fit enough for that, but they all complain about the last kilometer. They say that that's the longest of them all. So radiation over a 6-week period will progressively and slowly add on layer upon layer of fatigue, urinary irritation. Just behind, there's the rectum with rectal irritation, loose stools, frequency. But again, all of this gradually happens, stops, and gradually goes away again. So none of these side effects are permanent.
Doc, let's talk about brachytherapy. You have radiation now in the area where there's cancer. Can you go to work? Can you be intimate? What are the parameters?
Brachytherapy does not only apply to prostate. You can do that in other organ systems as well. But for the sake of where we are now, so the seeds are implanted through the skin, behind the scrotum, under anesthetic. There's little tiny seeds, tiny, think of a tasty grain of rice in you, half it in all dimensions. These seeds are in your body permanently. They're not radio, or they contain radioactivity, but they're not going to actually flag you when you go through the airport.
Yeah.
They're made of a particular metal that is not going to flag at the airport. So, yeah, you could actually go around with normal life. Perhaps a few days later, you're back at work. Yes, work activities, normal. Daily activities, diet, life, eating, all of it normal. You'll hear in the past tense, years ago, we had loose seeds that can sometimes fall out and then be voided with urine. And that is where the old school risk factors of being intimate actually comes about, and that wearing of a condom with sexual intercourse was recommended. Nowadays, there are seeds that are actually stranded together, and they're going to remain in your body and never fall out. Their content, radiation, actually wears off over the subsequent number of months, and then they're just tiny little pieces of metal that is in your body. But activities of daily living continues as per normal.
And what's the story about hormone therapy?
Hormone therapy is the nice way of referring to the fact that we suppress your own hormones. Your own hormones is good for you, but it's also very good for prostate. The reason why prostate normally grows over years and impacts the voiding pattern, and older men typically either have a weak stream or have to go regularly, is because of that very same wonderful hormone called testosterone. But if we take the testosterone away, we suppress it either through therapy with tablets or with injections, the hormones are less, and then there's less growth factors for the prostate, and the prostate starts shrinking again. And we either use that as a supplement to therapy, or in some odd cases, a single modality of therapy, but it can be worked with radiation, can be used with brachytherapy in various of those scenarios to weaken the enemy so that we can fight and succeed much more.
Once you've had the hormone treatment and you've reduced the testosterone, does that mean that the patient is in that constant state for the rest of their lives?
Good question, and the short answer is no. The injections that we give either in the buttock or in the stomach sends a signal to the testicles, and it's like power stations number 1 and number 2 get shut down, and temporarily there's no power being made, there's no testosterone being made.
So load shedding.
But this load shedding in all senses of the word, but it is not permanent. Once the medication stops, the testicles become get back to life. They start firing again. It's like a factory that actually gets back on power and starts producing again. And yes, it is a completely reversible technique. Obviously, age is a factor, and if you give a 21-year-old these injections, unethical as it would be, it would literally work for the 90 days, 3 months. But if a man is already age 90, his testicles is also 90, and is not going to immediately, wear out after 30 days. It has a long effect and can then often last for 6 months before testosterone recovers.
Thank you so much, Doc, for such an engaging conversation. I've learned a lot, and I'm pretty sure our viewers have learned as well.
Thank you. It's been a privilege.
And thank you for watching. Don't forget to subscribe and hit that notification bell. Join us next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.